Friends, I am Dr. Amdekar. In this video, I am going to focus on interpretation of head size. And this is very important part of clinical examination, especially during the period when the brain is growing. And this extends certainly up to 2 to 3 years and to some extent even up to 5 years. Friends, the brain fastly grows during earlier periods and thereafter the brain almost stops growing. An indirect measure of brain growth is reflected onto the brain size, though we must remember that brain growth reflected by head size does not necessarily correlate with the brain function. But that's a different part. But to begin with, therefore, measurement of head size is an important part of clinical examination, especially in the first 2 or even up to 5 years when the brain growth is nearly complete, and that is reflected on the head size. The head size is measured in terms of circumference of the head in the widest part from occipital protuberance on the frontal side just above the ears or above the eyes, and it's called as occipitofrontal circumference of the head. At birth it is around 35 centimeters, and you can see how the brain grows fast and therefore the skull also grows fast, and in the first year the growth of the skull increases by 10 centimeters and becomes almost 45 centimeters. Good 70% of it comes in the first 6 months and the remaining 30% on the next 6 months. Thereafter, the brain continues to grow, but compared to the first year much slowly, and it takes about 2 more years to become 50, which means in the first year it grows by 10 centimeters, but in the next 2 years, between second and third year, the growth is only about 5 centimeters, and the adult head circumference is only about 54-55 centimeters. It suggests that the brain growth nearly stops almost at 5 years, but large part of it is over by the first 2 years. Having said this, that it's important to really pick up a growth of the skull and measured as head circumference, what is important is to serially monitor the growth of the skull as well, especially in the first 2 years. Now the skull may look small and we need to confirm by correct measurement, and if the measurement of the head size or head circumference is less than 2 standard deviation or less than third centile, then we call it a microcephaly, and we need to look carefully what's the cause of microcephaly. But more important is, majority of these children have some developmental delay, and obviously if the damage to the brain occurs during the fast growing period of the brain, like a later part of pregnancy or a perinatal part, or at times a very early postnatal part, then the brain is damaged during that period, the brain does not grow normally, and you are left with a microcephaly. Thus, much before the functional derangement is evident clinically, one can even pick up a microcephaly by measurement, and that is important. And a linear measurements to follow up will tell us how the head is growing, in other words the brain is growing. As I said, almost all children with microcephaly have a delayed development, but there is an exception in the form that autosomal dominant microcephaly, which means one of the parents too have a small skull. Such children, and of course their parents too, are absolutely normal in terms of intelligence and brain function. So with an exception of an autosomal dominant microcephaly, all other children with microcephaly tend to be developmentally delayed. However, there is another cause of a microcephaly, and that is if the sutures on the skull fuse very early. Normally, friends, the sutures get opposed to each other by 12-18 months, but are permanently fused only by about adolescence or near adulthood. And therefore, if there is a premature fusion of these sutures very early in infancy, then the growth of the skull is arrested, but the brain inside wants to grow. Therefore, such a situation presents with headache, vomiting as an evidence of intracranial hypertension, and it needs a very urgent surgical intervention to get rid of this sutural fusion, and therefore allowing the normal brain to grow, and such children grow very normally. Thus, microcephaly commonly occurs because of some chromosomal anomaly or a late intrauterine damage, or of course a perinatal damage, commonly hypoxic ischemic damage, and many other causes of such perinatal damage. Having discussed microcephaly, there could be also macrocephaly, which means that the head circumference is greater than 2 standard deviation or more than 97 centile for that particular age. Friends, almost similar to microcephaly, even many children with macrocephaly seem to be also having a delayed development, but with another exception, that it could be a benign megaloencephalopathy, benign large head, often again genetic, and barring that exception, many children with large head may also be delayed development. But another exception to this rule is a hydrocephalus developing pretty early in the first year or so, and in such children there is obviously a sutural separation and a boggy fontanelle, and these children have near normal mental function. Of course, hydrocephalus could be secondary to achondroplasia or an osteopetrosis, or of course due to commonly some obstruction to the ventricular CSF pathway. Therefore, once you see a macrocephaly, you need to be sure that it's not a benign megalocephaly or also hydrocephalus, but otherwise the macrocephalic children also tend to be with delayed development. And the causes could be many, like some of the neurodegenerative disorders like Tay-Sachs or Canavans, like some of the syndromes like Alexander syndrome, some of the neurometabolic disorders like glucotic acid defect. All these conditions also can cause a large skull, and the whole idea of this video focusing on head size is very easy to measure. It's an important part of measurements of the body, including weight and height of course, but the head circumference in the first 2 years in particular is an important measurement. And if you see any deviation from the expected, either smaller head size, microcephaly, or a larger head size, a macrocephaly, it's time that you look into it very cautiously and pick up what best you can find out the cause. Some of them could be preventable, some of them can be curable, or at least they can be salvageable to some extent. Having said this and emphasized the importance of head size, sometimes in the first year in particular, the head size and the length are reasonably proportionate, and one can easily consider a simple formula that the length in centimeters divided by 2 plus 9.5 is an average head size expected of that 1-year-old child. Thus, even if you did not have earlier head circumference, you can assess whether the head circumference is normal or not. Friends, therefore, one important area of looking at the development of the brain function is a head size, and I call it a head start. Of course, general examination also starts with head. We call it head to toe examination, but in relevance to development and the issues related to neurodevelopment, head size is most important. I hope you listen to subsequent videos where my other colleagues take up other issues related to neurodevelopment. And again, a request for all of you to continue to be with us and also spread this information to your colleagues. I hope you are all enjoying this and hope to see you again and again on our videos. Thank you very much.